if I fall down a couple of stairs and break my arm,
Yeah.
what are you going to say to me?
Get well soon. Go to a doctor.
Go to a doctor. And I'm not a social media influencer. I'm not somebody who, I have a TikTok page. I have a couple thousand views here and there. But my content is educational. It's like, what exactly is TMS? What exactly is ketamine? Let's talk about psychedelics, right? And those conversations.
I was reading one very interesting thing about TMS. In US, a lot of people are using these terms. A lot of search terms are also there. But India, nobody is aware about this.
Your brain's gone to the gym, but it hasn't been working out. So it's become a depressed brain. Think of TMS as your brain going to the gym and lifting weights.
Oh, wow.
It's practicing being happier and getting better and better and better at it. If you don't have anxiety at all, if you come to me and say, I have zero anxiety in my life, then you're an alien. You're not from this planet, because it's not possible.
Like I was actually taught in my childhood, every day should be a happy day.
There is an essence of shame and guilt, I still think, in India. But in the US, there's definitely sentiment of acknowledgement, but we're kind of ignoring the elephant in the room.
So today we have a very special guest, Dr. Karan, founder of MyCohi. He's a TMS specialist and a mental health specialist as well. He's from the US. So today we're gonna talk about what is the difference of mental health issues which we are facing in India versus the people in the US. Then we talked about how as a psychiatrist and a doctor, you can scale your practice from today if you are X, then how you can reach to 10X. Then we also talk about some of the controversial topics. So watch this podcast till the end. So let's welcome Dr. Karan.
Thank you for having me. Hello.
So just like we take care of our bodies, do you think we also need to take care of our minds and hearts? Situation, if currently I talk about India, a lot of people have difficulty in talking about mental health. They are not open and free enough to talk in front of their family, in front of their friends, and even in an open stage about mental health. So I'm curious to know about this thing. Is the same situation happening in the West as well, or they are more open about talking about mental health?
Yeah, no, that's a great question. There's definitely a paradigm shift. I think what we're seeing is, culturally speaking, young people are starting to realize there's a conversation to be had, but there is an essence of shame and guilt, I still think, in India, from a cultural standpoint too, societally speaking. But in the US, there's definitely a sentiment of acknowledgement and wanting to have a conversation. But think of it this way, we talked about this, to many people in this space, whether it's patients or a public platform. If I fall down a couple of stairs and break my arm, what are you going to say to me?
Get well soon. Go to a doctor.
Go to a doctor. But if I come to you and say, I haven't slept for 4 days and I'm feeling super, off, and I'm having negative thoughts about myself and I may hurt myself. What is the thing you would say there, right? It's in some cases it's awkward, it's difficult. So I think the mindset is just like any physical type of injury applies to mental injury. There's something called a pathology of disease or an injury or medical issue, and the brain is just like other parts of your body. It can go through some trauma, it can go through some injury and seek help.
So in that case, you are thinking like our previous cycles or our childhood trauma is something which is building up the anxiety in the people, or ADHD or depression, or how it is, like how the pattern is built. Because some people I have seen, they are super happy from outside. But there is some kind of depression and some kind of anxiety inside them which they are not showing up to the world. Versus some people, they are like, when you talk to them, you feel the energy. Okay, this person is like, superly unhappy, and the person is draining your energy. So how, what is the difference? Is there something, people are carrying the baggages of the previous generations, or how it is building up?
It's interesting you asked that question, because in the 1920s, the evolution of the telephone became a thing, and there was comics designed to say that, we have this we're going to have a sense of anxiety and stress because of technology. And we thought anxiety was high then. It's not any different, technically speaking, today. It's more acknowledged.
Okay.
Back then, it was still there. Today, it's still here. There's more of an acknowledgement of it. But to answer your question, you know, is there a buildup? I mean, first off, we have to understand anxiety. It's normal to have anxiety. If you don't have anxiety at all, if you come to me and say, I have zero anxiety in my life, then you're an alien. You're not from this planet, because it's not possible.
That is true.
Anxiety is your body's defense mechanism.
Exactly.
It's telling you something is wrong. It's telling you something does not feel right. And it's the fight or flight, the fear, the uncertainty, the doubt of something.
Yeah.
That's normal. When it becomes limiting in your life in terms of work, family commitment, relationships, your own health, your own level of functioning, then we call it an anxiety disorder. And there's multiple different types of anxiety disorders, right? You can have social anxiety, you can have other levels of anxiety, but it can build up. It can be from trauma, it can be from environment, but like any mental health condition, it's multifactorial. Your diet, your environment, your genetics, your just something pathologically that takes place in your brain. It's not like there's one clear root reason why we have it, but we have it. And as far as ADHD goes, I think we're seeing it more. Case in point, I've dealt with anxiety myself, you know, and I think I have ADHD.
We all have
I think we all have it, right? But I think because of the amount of things that we have to stimulate us in so many different directions, from TV, cell phone, computers, that our attention span is becoming limited, but our amount of stimulation is increasing. So could that explain it to a certain extent? But it's definitely more prevalent.
So can you also touch point on what are type of mental health issues which people are having nowadays? And if you can compare it decade back, like what is a shift in the behavior of the people? Like as you mentioned, like in 1920s, people were anxious. The anxiety word comes from there, and it is more or less similar.
The anxiety acknowledgement was there. Like the technology gave us the fear that we're going to become some sort of civilization that's going to be dependent on technology. Turns out it's true. Does that mean more people have anxiety? The answer is no. But as far as what's happened in the last 10 years, so I mean, first off, the elephant in the room, COVID, right? I mean, I think that kind of exacerbated and made things more difficult, but also made us realize, oh, wow, we are susceptible to a lot of mental conditions because of something drastic like the world shutting down. And losing contact, communication. I think people realized how important in-person communication is. Talking to somebody on a computer screen is not the same as talking in person. We could do this on a virtual platform on a laptop with a camera and do a podcast like that, but is it the same as this? No. So I think human connection was impacted in the last 10 years. I also think that young people, especially, not to make myself feel old, but young people, are just around so much information, stimulation, and I think we are starting to see the effects of that. So 10 years ago, the TikToks, the Instagrams, the Facebooks, they're not what they are today.
Exactly.
And I think that plays a big role in it. So, yeah.
And like what kind of doctors are there who treat this kind of, mental health issues? Because I think like a lot of people are confused between who's a psychiatrist, who's a psychologist, if I have ADHD, where should I go, how to what kind of doctor are treating my problem?
Yeah, no, that's a good question, because it's like, who do I go to, right? It's like, well, because I as a friend reach out to someone and say, I'm not feeling too good. What does that friend say? Go talk to a psychiatrist. Is that the first line of action?
Exactly.
And there is a certain cadence to it, right? If you are somebody who's never had a mental health discussion with a clinical provider, when I say clinical provider, we're talking about somebody who's a psychotherapist, a psychologist, a psychiatrist. What do these all mean? A psychotherapist is a counselor. There's someone who's going to talk to you. They're going to converse with you about your thoughts, your feelings, your emotions through different techniques, which are through cognitive behavioral therapy or dialectical behavioral therapy, which are just different ways to understand your feelings, your thoughts, and to process them and to develop skills to redirect them, to get through them, to work through them. Even for trauma patients,
Right.
counseling is there. So counseling, psychotherapy is talk therapy. A psychologist is a doctor, right, a PhD, but a psychologist will go into a further assessment or an evaluation to really
Okay.
go on a deeper psychological level of what exactly you are dealing with from a diagnosis standpoint as well.
Okay.
So a counselor can give you a diagnosis, a psychologist can give you a diagnosis, but the difference is you're going into a deeper level of what we will call the clinical psychology. So you are going through an assessment and evaluation, multiple levels of testing, so it's very in-depth. A psychiatrist, which is where my background falls into, is more somebody who does some element of psychotherapy and psychology, but I'm prescribing you a medication.
Okay. So psychologists can't prescribe you any medication?
They don't prescribe medications, no.
So they work only on the behavior of the person,
behavioral component,
the patterns like which person is having, and then working on those.
But see, they can also work with you on your medication discussion. That if your psychiatrist prescribes you something, a psychologist can assess how that person's responding to it. So further follow-up and assessment can tell you this. My psychologist told me that I'm doing better because my psychiatrist started me on the medication. There needs to be more of that collaborative care in a perfect world. Is that the case? Not necessarily. And I will say one thing that I think is interesting, and this is not to offend anybody in this space, but there's a increase in these self-proclaimed life coaches. And I don't want to say...
I was coming to that.
I don't want to be rude, but it's like, no, like it's great. There are people that can help you become the best version of yourself. I'm all for it. But there is this massive increase of people that are these life coaches. And it's interesting to me because if you're 25 years old and you're a life coach, that's really opportunistic. Of course, at 25, you feel fantastic and everything makes sense to you. Yeah. But when you're in your 40s, you're still a life coach then we can talk, right? So I think there's a certain difference of what people look to in terms of help. A life coach is something different, and so is a counselor or a psychologist, right? So
every person is saying, okay, I'm having OCD, but they don't know what exactly is OCD. But I'm thinking, okay, I'm having OCD. I want some treatment to be done.
Sure.
So as an individual, as a patient, how I will find? I will write on Google OCD treatment. I'll get psychiatrist, I will get psychologist, then I'll get NLP coaches. So how I will find the right person for myself?
Yeah, I mean that's a good question again, and because it's what people go through on a daily basis. I think first of all, a patient, somebody who has a mental health concern, symptom, they are a consumer. They're looking for a service.
Right.
And like anything you do, when you're buying something online, you're buying the new iPhone, you're gonna do your research.
Right.
Do your research, right? Understand what are the different levels of care. How do I find what opportunities I have to get help, and understand the difference between what type of provider does what in terms of a clinician. But if, again, you haven't started out in any type of mental health treatment in your life, and you feel you have OCD, yes, you can go to a psychiatrist, but their first resolve is to, unfortunately, I hate to say it, is to give you a medication if they feel it's warranted. And 9 times out of 10, that's what ends up happening. So what we do see is a shift in that as well. But we are at this time where OCD is being more excessively treated. And before, it was through psychotherapy, counseling to help you fight these obsessions and compulsions. And really quickly, let's talk about what OCD is. OCD isn't just, oh no, I didn't lock the door, so I'm gonna go check it 4 times or 5 times. And that is some element of OCD, but OCD can also be, I'm walking down the street and I see a lady walking her dog and I have these thoughts that I want to kill that dog. That can be an OCD type of symptom. Obsessive, intrusive, repetitive thoughts, and the compulsion leads you to act. So therapy will help you understand that. A psychologist could help you dive deeper into the assessment of how severe it is. And a psychiatrist can give you medication to deal with it. But along those lines, this is what's interesting. And again, to all my fellow psychiatrists and providers in mental health that provide psychiatric medication, it's interesting. You do an intake, right? As a patient, you fill out all these forms. You talk to a doctor for 2-3 hours or however long. So you start here, you go to this large portion of information, and then you end up back with like 5 or 6 options which are just medications. So it's like, it's really silly, right?
Yeah.
And not to say medications don't work, but it's not a cure. It's a part of the treatment process. So to answer your question, you do research as an OCD patient, you have to look at what are some of the first steps? What are some options? What do I do? How do I take accountability? What are some things I can improve on my end as well as a patient in terms of my environment? Is there something that's triggering my OCD, making me have these symptoms more often? That can happen too, right? So there has to be, I guess the word is a comprehensive process to the whole thing. Yeah.
And why, when a patient should go to a doctor? When, like, okay, stage one, as you mentioned, the research phase, wherein, okay, I'm searching, okay, I need therapy, and these are the things which the options are available.
Yeah.
But as per a doctor, what do you think a patient should visit the doctor in at the stage wherein, like, the patient is feeling, okay, it's a pre-stage, I will take some time, I'll work on myself,
Sure.
I'll change my routine, do some meditation, and then, go to a doctor? Or what, as per you, is the best time to visit a doctor?
Well, so I'll ask you this question and think about this, right?
Yeah.
You're going for a run or a jog and you see a bit of a curb and you miss it and you sprain your ankle. Now, if it's a mild sprain, what do? You just say, okay,
I'll just spray with,
something or put some ice on it, right?
ice or ice pack or
But let's say you twist it the whole way and then you see this black and blue bruise and you can't walk. Now you're going to,
then I have to go to doctor.
because you can't walk, right?
Yeah.
You got it. Your daily life is impacted. So in a similar fashion, you have to understand what exactly is limited for you. Are you not able to go to work? Are you not able to be a husband or a wife or a sister or a brother or son or a partner or girlfriend, boyfriend? And then are you not able to function and do things that you love to do? Or is your life being limited from an executive standpoint, cognitively speaking as well? We look at both of those. So those things are things I would consider. But going back to it, it's also realizing that it's okay to have some bad days.
Yeah.
The moment it becomes debilitating, you lose your functioning capacity, you can't be yourself, and that becomes a chronic problem,
Exactly.
then it's something, that we should consider. And I hate to say it, a lot of people in the US, we do this thing where it's like 7 days in a week, I have one bad day. Oh, I'm depressed. No, you're not depressed. You're a normal human being. You could have one bad day in a week.
Exactly.
But if it becomes a situation where you are consistently falling into a pit, not enjoying what you used to, not yourself, you're tired, you can't concentrate, sleep is a problem, and you're hopeless. These are symptoms of depression.
Because that is what I think the conditioning happened, wherein we were taught I was actually taught in my childhood, every day should be a happy day.
Yeah.
You should not have bad days, because that is something which give you fear, anxiety, fear of losing yourself. Sure. So hence I think that is a conditioning of every Indian household.
I think for the whole world, for that matter. Yeah.
And also, if I talk about Indian household majorly,
Sure.
so there are people I talked about, they are aware about, they have mental issues, but
Sure.
there are a lot of people out there, they are not aware. They're saying, "Sab changa hai, everything is fine
Sab
around
kuch
me.
theek hai."
Sab kuch theek hai,
Yeah.
I am absolutely fine, but inside them, they know, there is something which they are not happy about in their life,
Sure.
but to the world, they are the happiest couple or happiest, in a relationship.
Yeah.
But I think there is a big disconnect in household of Indians, wherein they are having this shame of telling other people, I have this mental health issues, and hence they are not opening up.
Yeah.
So can you tell, is it same for the US, or US is more open about mental health and there are no problems in US?
Yeah, it's a great way to pose that. I think, we'll talk about India first, because I think the term is, somebody's not sounding right or something's off. You send them to the Pagalkhana, right? That's what they say, right?
Yeah.
And what is that really? That's not everybody who has a mental health issue goes to a psychiatric facility. Those do exist here
Exactly.
and in the US, right? So I think that conversation is shifting. But as far as the US, I think as an American, I can tell you that there is a certain element of enabling some of this, and there's some element that I think is very authentic in terms of people having some real problems. And what I mean by that is that we are a country of gratification. I think that's where the Western influence comes in.
Okay.
And I know this might be a little bit of a tough thing to hear for some people, but it's the truth. I mean, we have this mentality because we feel that we are the greatest nation on earth, that everything should be hunky-dory, and it's not. Current climate we're in reflects that. And I think mental health, as we call it, is not so black and white.
That's why we are in black and white.
Yeah, that was not intentionally, but yes, you're right. But it's not so black and white. There's a gray area, and what I'm seeing in the U.S. is that we are becoming a nation of an opportunistic industry in mental health, and that's why, not to be a conspiracy theorist, but there is this big pharma influence that, mental health, it's a booming industry. It is. I'm in it. I'm somebody who makes money in it, but I believe in doing the right thing and making money at the same time. You can do both. They're both mutually exclusive. The problem is that we're on the other end of the spectrum in the US. Like, if something's wrong, it's mental health. Or if you're having a bad day,
it's mental health.
It's mental health.
Well, they're overdoing it.
I think, no, let me rephrase. I don't want to say overdoing it. I think we are starting to be overly sensitive to normal things that happen in life. I think we're letting the people who actually need help fall through the cracks. I think we also understand there's something called the metabolic connection. There's something called metabolic psychiatry. Why is that a thing? Because it's not just everything happening up here, it's what I put in my body. There's a gut-brain connection. And being here in India, I will say the food here has been great because I'm not feeling what I feel over in the US. The food does impact you there. We are full of preservatives, processed foods, inflammatory diets. That makes you feel not yourself. So we're ignoring that part of it. And then on the other end of it, we're, trying to capitalize as a industry on the revenue models, which again, yes, everybody has to earn an income. I understand that too. But to what extent do we opportunistically enable people to feel that something is specifically wrong with them versus actually saying, hey, you know what, there needs to be a focus on the organic understanding of what depression and anxiety and bipolar disorder and OCD really is. And to a lot of providers, psychiatrists, I'm very encouraged by them that have been pioneers in this space. They have done research. They are amazing clinicians and doctors and researchers in the US. But we're kind of ignoring the elephant in the room, which is our current political climate. That contributes to your mental health.
Exactly.
And so that's a problem as well, so.
Can you put more light on that?
Oh no, we're doing that. Yeah, I mean, let's ruffle some feathers, huh? Yeah, I mean, look, not to pick a side or anything, but I think if we are such a pro-mental health, we are a pro-mental health country.
Right.
And if we are going to wear that title and that badge, then I think we also, and this is where some of the doctors, the people from Stanford and Harvard and your Yales and your executives of insurance companies, which, well, let me rephrase on that because they're not really interested in too much of righting the ship a bit, but your leaders, clinically speaking,
exactly,
I think should have more of a voice in what exactly we're doing as a country, because it's no secret, we understand how important mental health is, but if our leaders are giving us an example that mental health isn't important by their actions, by bullying, by fabricating, by
increasing the tariffs.
Well, I think you're playing with people's lives.
Yeah.
Right. I have my own personal convictions against why I don't feel we have great leadership. I don't necessarily think it was great before either. I'm not saying that it's apples and apples or apples and oranges. Clearly, they're very different. But parties aside, I think. Do you want severe damage to be done or moderate damage? And I feel like we're at that severe damage state because we're starting to see a lot of people being impacted mentally by what's happening. I can't tell you how many clinicians, psychologists, doctors that are saying, I don't know what I want to do because my patients, can't afford to come to me at this time. So they're letting their mental health be secondary. First thing is groceries, rent. Mental health is second. And why is that? Why
So
should
this
that
shift is happening recently?
This is recently. I won't say recently. This has been for a couple of years now, but it's not necessarily one administration or the other, but I think you're exacerbating the problem. And we can talk about treatments in mental health, in psychiatry. We can talk about innovative treatments. We can talk about medications and all that good stuff. But if you're not talking about the elephant in the room that's contributing to the problem, then you are simply maintaining the problem.
Exactly.
And that to me is something that I think needs to be addressed. And I encourage those that are on a level, on a higher platform, that have the attention of millions of people to speak about this, because it's trending, right? The Hubermans and whoever, no disrespect to him. I love what he does in his podcast, but like, let's call it what it is. Call a spade a spade. And I think that
have
needs to be
courage
done.
to at least talk about that.
Yeah, we could talk about everything else. We talk about addiction, and you talk about OCD, and you could talk about like testosterone. And he has all these discussions, and I feel like, and I'm not necessarily saying him, but I think there's so many people in the space that are just like missing the bigger picture. Why is there such divide? Right? Everybody especially in the U.S., and I feel like India is dealing with that politically too.
Right.
That there's a big divide and it's become very black and white, not to reference the outfits again, but it's like you're either on this side or you're on this side.
Exactly.
And there is a middle. There
Right.
is a common ground. There is a balance. And that's what the whole world is about. Our bodies, the way they function, the way they exist is from balance. We have balance in our brain that can be imbalanced, that leads to mental health symptoms. We call it a chemical imbalance. It's actually electrochemically imbalanced. Our bodies work the same way. I think our thoughts, our emotions, our environment should reflect the same. So.
Okay, so I like when you were talking, I remember my childhood when I was in college. I used to tell to myself, "Oh, I'm so depressed. I have exam tomorrow, and I'm like, I'm so like I'm having bad day because tomorrow I have some culture event." So like we in college, I remember we used to use these terms very casually.
Sure.
But while growing up, I understood like these terms are something like which are very crucial to other person because these are related to mindset and mind.
Yeah.
So I wanted to know like how was your like upbringing when you were growing up in
God.
the like in US and the environment around you, the surroundings.
Yeah.
I wanted to know more about that.
Oh man, how much time do we have? This can go for a long time. Being an Indian in America was different than it is today. I'm very blessed for the opportunity that I've had. I'm grateful for my family and my parents, giving me the life that I've had and to do what I've done and to help people and to have a voice. But it's come through a lot of experience, and I think it shaped me into a person that I am today. And I still have a long way to go. Life's life's a journey, and you will continue to learn. But I mentioned I have anxiety, right? And it's not something I deal with every day, but it does play a role in my thoughts because they're intrusive and irrational and repetitive, and you ruminate. So that was something I dealt with in school, and not to knock on it, but like if you're an Indian child growing up in the U.S. and you get a math test and your marks are at 92% of 100, your parents like, why not 99, right? So that can condition you to be like, I need to do everything 5 stars, A+, 100 out of everything. So that became an issue, but it wasn't something my parents did. It was something that I put upon myself a bit. And there's an old joke, I always joke about this with my colleagues and friends. It's like, not that my father said this to me, but I just think it's funny. It's like, Dad, I want to be an actor, or something. And he's like, no, son, it's pronounced doctor, because the expectation is
exactly
above and above.
Right.
And so I think Indian culture in the U.S. for people there is the stars, reach the stars. I think that plays a level of stress and anxiety. But then I also think there's a certain level of, especially I grew up in Staten Island, New York, which is one of the boroughs of New York City, right? And this is in the mid 90s. And there was not many Indian families there. Shout out to all my family and friends in Staten Island. We were the first ones there. And I remember taking the school bus, New York City buses, and going to school and kids looking at you like, where are you from? You're India. Oh, you bathe, or what do you eat? And you guys like use your hands and things, just ignorant, arrogant questions. And dealt with that. I had a friend, actually, two friends. They had, they wore turbans as boys, and so they had the jura and everything on their
Yeah.
head. And I remember kids grabbing it and
Oh,
pulling on it, thinking it's a tennis ball. In my mind, I'm like, that's not cool. So, and
yeah.
the idiot that I was, I decided to fight those kids because I want to stick up for my friends. And I realized, man, like this is hard,
Yeah.
and so it makes you feel like
It's
you
hard.
were an outsider. And who do you connect to? And every time I come back to India, it's crazy because I'm like, oh man,
I'm home.
this is what it feels like to like, everyone looks like you. This is what it feels like. Whereas over there at that time, there was a
Yeah.
sense of inferiority a bit, and definitely some limitations. And I'm a basketball guy. I'm a former college basketball player. I played high school. I'm one of the only. I was the first Indian in my school to play, and that was also interesting because tryouts, the coaches, they didn't think you had anything in you. So what are you, Indian? In Narwal, you playing basketball? Hit the weight room. Let's see if you can shoot. They push you a bit. And again, not that it was a sensitive thing, but it shaped you into a person to have that strength
Exactly.
and resilience. So
Right.
some of these things gave me some positive experiences and skill sets, and some of these things have been things I had to work through, right? So, yeah.
I'm sure like you have cope up this thing like in a very nice way, and the challenges which you have faced in your childhood,
Sure.
that is what build up
Yeah.
the person you are today.
Yeah.
But I've also I have some fear the Indian child who is unaware about where the parents are not that educated. They are
Yeah.
pushing the students to be a doctor,
Yeah.
to be on the top every time.
Yeah. Yeah.
And they are in the end they are cribbing about when their kid is he's suffering in his life. But they're not taking accountability as a parent. They're
Yeah.
saying mera bachcha aise hi hai, ya fir the kid is having, and they're also not acknowledging the fact this
Yeah.
child need counseling.
Yeah.
So what you think the parents should do in that situation wherein they are upbringing the kid in a way
Yeah,
where
yeah.
they can be a beautiful
Well,
soul?
I think that's changed. I can tell you in the U.S. From Indian parents, there's a lot more objectivity. Like you are more open to your child's strengths and skills because we see it in Indian culture in the U.S. You see young Indians that are in entertainment, music, arts, media, right? We have, if you look at I want to say Indian, but South Asian too, in sports, our commentators, there's such a prevalence. So there's an openness to it. But what do I tell parents is your question? Like what do you want to tell them, how to approach it? I just think there's a fine line of being overly sensitive and a fine line of being acknowledging too of what your child's going through. And I think that needs to be discussed more. I think one thing I would say is just kind of letting your child become their own person. I'm not a parent, right? I'm not. And I know that's a task that's very...
But you're a dog parent.
I'm a dog parent. She's a personality too. Shout out to Kohi. I think any good parent, and like my parents have been, they've had their pros, they've had their cons, but they've let me be who I want to be inevitably. And I think you don't want to restrict growth, but you do want to make sure that they have the right resources and environment to grow.
Exactly.
And that's kind of the big difference, because some people can be in an open position in life. There's some kids, that, and I think this is, not to knock on children that come from very privileged backgrounds, but it's kind of interesting, right? If you see a child who's got all the wealth, all the opportunity, and all the wealth and the opportunity in the world, and full resources, I'm not saying every kid that comes from that background ends up having difficulty, but for some reason, you see a lot of those kids ending up with issues with alcoholism or
Exactly.
drugs or something that it's just like, wow, why did this happen? So I think too much comfort and success and freedom can be a problem sometimes, and sometimes pulling it back a bit and making sure that understanding struggle is a good thing. And if your child has difficulty with something, don't think of it as a bad thing. Think of it as an opportunity to let that child grow into something that
Exactly.
is the best version of themselves. So, yeah.
Yeah, and in your OPD, when the patients were coming and the patients are coming, what common problems and issues you think they are having nowadays?
Man, yeah. Well, it's funny you say that, because now it's, there's a big discussion in the U.S., right? The transgender discussion, right? And I've had a few transgender patients.
Okay.
I have a patient who at one point was a girl and now was a boy, right? And She came to me for treatment, and we worked on her for a couple of months to help her out because anxiety and depression was high. At the same time, you're going through testosterone treatment.
Exactly.
So there's like something you have to understand. You're like, I didn't want to be insensitive and say, hey, look, this transition you've made is definitely impacting you. And I'm not here to tell you that you shouldn't do that, but understand the choice you're making and what you're doing to yourself. So that's one component from a society standpoint. I think the other part of it is what we put ourselves around, expose ourselves to. If I constantly listen to, if you listen to The Weeknd, right, the first two mixtapes, House of Balloons and Thursday, it's depressing music. If I listen to that every day, that's depressing, And it's all about drugs. so like, if you start doing that and your environment's full of that, your likelihood of going into a certain pit of depression is there. And let's talk about something that I think is a big deal is marijuana use.
Yeah.
It's a depressant. So if you're depressed and you smoke marijuana, which is what I experienced with a number of patients, I meet with them, we're sitting down, I'm taking notes, and I'm like, so tell me, do you smoke pot? Yeah. How depressed are you? Really depressed. How often do you smoke pot every day? And I'm like, well, is that a problem the patient has, or is it a problem of education? It's a problem of education.
Right.
We don't tell people that if I put something in my body, what it's going to make me feel. Marijuana is a depressant. It slows things down.
Right.
So if I'm already depressed, I'm making things worse. To answer your question,
Okay.
you have a lot of people that there is a self-sabotage taking place. There is definitely organic, genuine conditions that people deal with, but there's also decisions that people are making that really puts them in this position.
So as you mentioned, like marijuana, that is
no.
legal in US.
Do we have some here? Is that what I'm talking about? No, I'm joking.
But it's not legal in India. Like, but what are your views? Because I was reading about this and I came to know, like, marijuana is used and consumed in a right amount. It can cure a lot of things. So do you think, like, what are your views? Like, should it be legalized in India? Because a lot of people, I've seen like a lot of CBD oils are there, which are treating arthritis, joint pains. People are applying it. So, but I'm not aware about it.
Yeah.
Like, can you tell us more about
that's,
it?
hold on, let me get my water before I talk about this. This is going to get interesting. So first off, you said cure, right? I want to tell you right now, it's not a cure for anything.
It's not a cure?
It's
a distraction?
It's a treatment.
It's a treatment.
Yeah. Marijuana can be used medically for chronic pain, for chemotherapy cancer patients.
Really?
Yes. If you have appetite loss due to chemotherapy from cancer treatment, you need to increase your appetite. Marijuana is a great way to do that. And it's not invasive. It doesn't impact your liver like some medication. If I have chronic pain, I'm taking Tylenol or ibuprofen or paracetamol, right? Which I think we have here in India. I'm saying ibuprofen, Tylenol. But we use those meds. They go into your body. You have to break them down, digest them. Your liver takes an impact or something of that nature. Sorry, liver takes an impact. But you end up realizing that your body's going through all this impact, and marijuana is not as detrimental to your body as some medications are. With that said, if you smoke it, anything you smoke can impact your lungs and the other parts of your body. That can happen too. So clinically, there is a lot of evidence that marijuana is helpful, right, for a number of things. But to answer your question about, like, should we legalize it? I personally think, and this is just my opinion, I think if a country or a nation, whether it's the US or whether it's India, can sell alcohol and cigarettes and vapes, and we have something called kratom, right, in the US, which is an opioid tea-like drink or whatever it's called. These things can do far more. Well, that's a discussion we should have, because marijuana, clinically, it can help a lot of people. I truly believe that. I think I'd rather have somebody smoke marijuana than drink every day, because I think that person would survive versus the person drinking. But the question you have to ask is, why are they numbing themselves? That goes back to the root cause. Get some therapy. Let's talk about this. What exactly brings you to this point where you need someone to alter your state of thinking every day?
Exactly.
I know some people that are well-established, successful people that after a hard day's work, they go home and smoke a joint. That's their glass of wine. I'm okay with that. As long as you can be a functioning adult, you can take care of your family, be a good, responsible person, and do what you have to do, I can understand that. But if you're drinking a bottle of whiskey every night, that's a little concern
Yeah.
because that's signs of
Exactly.
alcoholism, right?
Right.
Now, there is something called cannabis use disorder. There's some people, and this is important I say this, there's some people that shouldn't smoke at all because genetically speaking, family history, or your way your brain is wired, you can have something called cannabis-induced psychosis. I've seen in the psych ward in Miami where I was training once, there was a young patient, never did drugs in his life, came into the ER, agitated, messed up, just not himself. And there were concerns of him doing something erratic to hurt himself. He ate a brownie made with pot or marijuana and had something called a cannabis-induced psychosis. It's a real thing. So also know yourself, your body, your mind.
Exactly.
If you're somebody who's really paranoid all the time and you smoke marijuana, you might not want it because you might think the government's listening to you or something and make you psychotic, right? So there's that concern.
Right.
So there's that. So yeah, hopefully we didn't ruffle any feathers talking about marijuana, right?
No, not exactly.
No.
I got your point. Like, definitely that is up to the government, like when they will legalized. But
I think they should.
that is what, like I also felt because it is coming to India for sure.
Oh yeah.
Through a illegal route or anywhere.
Oh, it's already been here, right?
Yeah.
It's in the farms and they
Exactly.
consume it
In
with milk.
Punjab, if you go, it's
Yeah.
a drug state. Like every other person.
Where'd you say? Is it Punjab?
Yeah.
All right, I'm going. I'm sorry.
So like it's a drug state and every other person is on drugs and it's actually ruined the country.
Sure.
So if they can, standardize and if it is consumed in the right direction and people are also aware about it, then I'm sure like a lot of things can be treated in the right direction.
Yeah.
And to add to this, like I was reading one very interesting thing about TMS. Which is like definitely in US, a lot of people are using these terms, a lot of search terms are also there, but in India, nobody is aware about this.
Yeah.
But I really want if you can tell what TMS is and how it can help people.
Absolutely.
If it will come like, with the full-fledged treatment plan to Indians.
You definitely went after the right question there. TMS, it's, wow. I'm a TMS specialist by trade as far as a mental health professional. I've done TMS treatment for years. I have over a little less than a decade of experience in it now, but TMS is short for transcranial magnetic stimulation therapy. It's here in India, by the way. There's in Delhi alone, in Gurgaon, there's probably 10 to 15 clinics here.
That is very small
very
as compared to our population.
Correct. Yeah, for sure. But it's here, which is very encouraging. What TMS is this. We're using magnets to treat conditions in mental health. And the reason it works is because the magnetic energy, so you have these coils that can be in a figure 8 design or different designs in terms of how they're made, but you place the coil in someone's head. Now, we figured out, and this is thanks to Sir Anthony Barker, the godfather of TMS, as I call him.
Yeah.
He figured out in 1985, the year I was born, one of the best years ever, apparently. He was able to understand that we can treat mental health conditions through this pulse of magnetic frequency. And the reason frequency works, these magnetic frequencies, because our brain has certain levels of energy, right? So if you do something like an EEG scan, you can understand that there's a certain frequency our brain is functioning at. If you're awake and alert like we are now, that frequency is pretty high.
Okay.
If you're starting to fall asleep, that frequency slows down.
Okay.
So we figured out, I say we, me personally, but have used it, we figured out that we can use certain levels of frequency and stimulation and pulses through magnetic frequency and treat certain conditions to either increase activity in a repetitive fashion or slow things down or stabilize things in a repetitive fashion.
Oh, nice.
And the way I look at it is this. Think of your brain as a muscle. Think of it as if you've been depressed for 15 years, you've taken medications, you've tried everything and nothing has worked. In a way, your brain has practiced being depressed. Your brain's gone to the gym, but it hasn't been working out, so it's become a depressed brain. Think of TMS as your brain going to the gym and lifting weights.
Oh, wow.
It's practicing being happier and getting better and better and better at it. But here's the big kicker. If I do TMS, is it a cure? The answer is no. It's a treatment, but it's a repetitive workout. My brain's going to the gym. It's practicing being happier. So if the weightlifting is TMS, what's the cardio?
Yeah.
psychotherapy.
Okay, so it's a combination of both.
TMS is a part of the treatment process.
Okay.
So if I talk to a counselor, that's my cardio for that muscle workout. I can't just go to the gym and lift weights.
Exactly.
Got to do some cardio. But I also have to do what? I have to eat right, sleep well. So if you look at that concept, I look at TMS as the weightlifting. I look at psychotherapy as the cardio. I look at what we do in our own time as a nutrition, the protein for the workout, the sleep, the lifestyle, the hygiene, what my environment is. So it's a comprehensive process. But what TMS has done, and this is why it's so exciting, medications in psychiatry, we have something like Zoloft, Paxils, Lexapros. These are all something called SSRIs, SNRIs. They're medications for psychiatry. They're effective because as patients, we're consumers. How successful is something? How good is it? Medications for mental health conditions are only about, first time at best, 40 to 60% at best. That's pretty, sounds okay, but not that great, to be honest with you.
Right.
TMS is about 80% or more effective in treating mental health conditions, specifically depression. So we have something that is far more effective, and this is the coolest part. I'm going right to the source. The medication, I have to take that, ingest it, let my body break it down, my liver is going to metabolize it, so what am I going to have? Side effects.
Exactly.
Side effects of medications are what?
Liver
Gaining
damage,
weight, liver
kidney.
damage. Well, if it's over abused or used, depending on the medication, but primarily side effects, we're talking about weight gain. More depression is a side effect of a depression medication. It's possible, which is crazy, right?
Right.
Fatigue, libido, sex, so desire for sex, desire to eat, gaining weight. That's not attractive for somebody who wants to get better.
Exactly.
Whereas TMS, that's not the case. So it's really exciting, super exciting. Yeah.
And what do you think, like, is India ready for TMS, or like we will take more time to adapt it? Because as I was doing my research, I came to know like US is already like, every other center is having TMS and everyone is talking about it. But in India, adoption rate is not that great. So what do you think? Like, are we not ready for it, or is it like something?
The whole world should be ready for it. How can India adopt TMS? I mean, that's, in a way, everybody in the world can adopt it, and they should. But I think one way is to really create more awareness and education. I as a professional mental health consultant and clinician and executive and whatever you want to call it, as a researcher, I believe in education.
Okay.
And when it comes to healthcare, anything you do for your body, your mind, you need to know exactly what it is.
Exactly.
You should ask questions. If you go to a heart doctor and they're going to do surgery on your heart, you're going to ask questions, right? So I think the education component is the biggest part of it. And for a country to adopt something like TMS, a community or a nation or a state, the biggest thing is, what is the element of understanding what this is? Because it's a foreign concept.
This is, yeah.
And people, you want them to commit to something, be compliant, buy into it. They have to understand that, what exactly is this? How does it work? Why am I a person who can benefit from it? That's probably the biggest thing for me, is the education behind it.
And if any doctor, for example, is opening a new clinic in US or in India, so how you think they can get their first 100 patients in their mental health facility?
Well, so talking today, because I work with a lot of TMS and ketamine providers, for transcranial magnetic stimulation therapy, if you are a doctor opening a clinic and you need to scale your practice and grow it, you want to help people, you want to help your patients, but you want to be in business because you want to feed yourself and take care of yourself, provide for your family and your staff's family, right? I think one of the ways to really do it is to understand the level of commitment you have to have so your patients can have it too. So talking about 100 patients, that's a great goal to have, but one of the best ways is to become a comprehensive facility. You cannot, these days, mental health is a very competitive market. If you're a counselor, you just offer counseling, you can do all right. But if you are a clinic that has a counselor, a psychologist, psychiatrist, multiple levels of care, you become the one-stop shop.
Exactly.
And it's all about convenience. Can you accommodate? How convenient are you? Do I have to go somewhere else for therapy? If I can come to one facility and get my needs met, then I can be committed and be a loyal patient
Exactly.
or a customer. And one thing I think is forgotten is that, especially with TMS, I'm just going to say it, so there's a lot of doctors out there, they feel this because you have a license to practice and you have an office that people should walk through your door. No, not at all. You are an option. You're not the only option.
Exactly.
So in order for a patient to choose you as the doctor of choice, who exactly are you? What is your credibility? Are you embedded in the community? Do people understand and trust you that you have done enough to be that experienced, valued choice, that provider of choice? Those things are the important connection that needs to be established. And TMS, it takes 6 weeks. You go every day for 6 weeks for a half hour per day for treatment. Someone's coming to you paying a lot of money, spending a lot of time, and changing how they feel. And you want them to come do TMS with you just because you offer it and you exist? No, there has to be a reason why you're the person I'm going to come to and put my life in your hands. So to successfully make a practice run, I think you have to approach it as a business, but as a clinic, and have best of both worlds. You have to be objective, comprehensive, accessible, convenient, accommodating. I mean, the list goes on and on, right? So.
And as a patient, how I will decide which doctor to visit? Because, for example, if I'm aware about, okay, the TMS treatment is there, and these are the doctors who are providing TMS treatment.
Sure.
So as per me, is it like this is a machine which is doing all the work of the brain? Like, for example, a gym wherein the treadmill is there and I just have to run for my push-ups, or I have to do the workout. But how I will decide as a patient, how I will decide which is the right doctor or the right clinic for me?
Sure.
Because when I'm Googling, like I'm going to Google, I'm typing like best treatment for depression or best doctor for the TMS treatment.
Yeah.
So there are 10 or 50 doctors which are coming up.
Yeah.
How I will decide like which is the best treadmill for me, or this is the treadmill for me or not?
That's a great question. And I think what you have to turn it back to is, how do you market yourself, right? And that's the golden word, marketing. But now, marketing isn't just what you do online. It's also what you do physically speaking. Building referral networks is marketing, right? But
Okay.
that's one element, and that's a separate conversation. But to answer your question, how do I decide as a patient
Exactly.
I'm going to somebody? Well, first off, your feedback. Google reviews speak volumes. And if you have 3 out of 5 stars on Google reviews and I'm coming, I'm probably not coming to you. I kid you not. There was a review I read once of a clinic, and the patient wrote, "I would not even send my dog to this doctor." And that made me laugh really hard. But that also made me realize that must have been a really bad experience.
Exactly.
So patient feedback is important. Now, does every patient leave positive feedback? No. It doesn't fully reflect the office or the provider, but Google reviews tell you a lot. On top of that, there is accessibility in terms of information. So going back to it, is the doctor, the clinic, is there information generic, or is there something unique about them? Does it show that they're not talking about the marketing tactics that people use in mental health, which is live your best life, and there's a lady standing get freedom, go back to being yourself. That's cheesy, fluffy shit. I'm sorry to say, nobody needs to hear that. I know I deserve to be happy. I don't need you to tell me that. Why you as the doctor, right? And on top of it, what are you sharing as a resource? What are response rates, efficacy rates? What is your experience? If you've trained at UCLA or whatever hospital, I should know that. If I call your office and the first thing your front desk does is, do you have insurance? Click. That's not the first thing you should be asking me, because you're just screening. You're not really talking to me. And those things are important. You see I'm getting a little upset about it because that's what I hear. In my role as a consultant, I assess clinics and say, do you actually speak truth to who you are?
Exactly.
If you don't, you're going to lose that patient. And that person's not going to get access to life-saving treatment. And now what we're doing is creating a funnel of people that are going through different routes or not getting the help they need because you left a bad taste in their mouth. I can tell you right now, there are people that could have done TMS therapy but chose not to because of the experience they had in terms of getting information, having an organic conversation, and actually being explained on what's going on. And you have to invest the time. So as a patient, find somebody who will invest time in talking to you and educating you and understanding your needs. Find somebody who is giving you a sense of comfort. If they have a social media page where they share information about give you a window into their practice, that gives me a sense of comfort. I, as a patient, I have the FUD factor, as I call it, FUD, the FUD factor. Fear, uncertainty, doubt. Eliminate those three, and I'll buy into this with you because I want to get better, right? So.
And what about social media? Because you talked about a lot of things about Google My Business. Definitely a doctor should have Google My Business. They should get the reviews done. And even if someone is searching in their 5-kilometer radius, they should pop up in the top, because if their work is good, then definitely they can ask for reviews and patient can do that. But what is your take on social media? Because social media again, if I talk about India, we don't have TikTok. Like you have privilege of using TikTok in US, but not in India. So here, what is happening is the trend which is there in US, like a week back, it is coming to India then. But a lot of doctors, they are not, very active on social media, thinking like Instagram pe mere patient nahi hai. Instagram is not for me. It is like for influencers and for other people. So what do you think, like how a doctor or a clinic can promote themselves on social media in a very ethical way? It should not also hurt the sentiment of the patients.
Yeah, I mean, you mentioned the word ethical, and I think that's a big consideration, right? I will say this. I think we're in an era of attention marketing, attention-based marketing, if you will. I'm not crazy about social media myself personally, because I think there's a lot of fluff. Distractions and fluff. Yeah, that's the word I use. It is, because I've seen clinics and providers and teams in these offices go and make a Canva image and like, did you know sunlight helps depression? No shit. Like what exactly about you will give me an insight into who you are. But to answer your question, I think what needs to be done with social media is more of a window into your office, patient-facing, provider-facing content. If you're a doctor, you're not getting in front of the camera and talking about what does this medication do? How does TMS work? What does our office specialize in?
Exactly.
What are some case testimonials? Maybe a patient who wants to share their experience. That to me speaks volumes. And then patient point of view, what it's like to be a patient in that office. If you can walk in and have the camera facing out and show this is the lobby, this is the waiting room, this is the front desk, this is the treatment room. Let me see that, right? And having fun with it, because to answer your question, in the grand scheme of things, what you really want is to have somebody understand the value and have a sense of comfort with you. And you said, somebody said, oh, Instagram isn't where I'm going to get my patients.
Exactly.
I hate to say it, but that's exactly where they are, because Google ads are sponsored listings. I'm scrolling to see who comes up most organically. Social media, I could have a sponsored ad or a boosted ad, but at the same time, I'm looking to see who has that engaging viral content that is actually educating me, giving me access to information I normally wouldn't have, and more importantly, creating a conversation that people want to know more about. And there's an old thing like, it's like, well, let me ask you this. I'm gonna interview you now, okay? When you hear the word psychiatrist, when you hear the word psychiatrist, right? What do you think of? Do you think of somebody who's smiling and happy and cheery?
I'm thinking like old guy with specs sitting on a sofa and writing the notes,
judging you and criticizing you, like,
and saying, okay, you are the person who is having mental health issues.
So think about that. We are changing that vision, that perspective, and so that's why social media is important, because what patients look at psychiatry and a doctor as in mental health is somebody who's probably a male or a female sitting on their couch taking notes and going, tell me how this, what else do you feel about this? Tell me what happened in this situation. And it just, that's not psychiatry in a nutshell. It's a part of it. There's so much more to it. And to the credit of a lot of good providers, a lot of good clinicians that I've had the pleasure of working with, there's some really good people out there that are doing really well with this. Clients of mine, colleagues of mine. And there's some people that are living our Narnia. Like they're their heads in the clouds, and they're like, I'm not doing well at my clinic because I don't get enough patients. Just because nobody knows exactly who you are, and at the same time, you're not doing something called best practices.
Exactly.
That applies clinically, operationally, and digitally and physically as well, right?
So in part one, we discussed, like me and Dr. Karan, we discussed a lot about mental health and what is the technology which now the doctors are using to cure mental health. So stay tuned for this part two.